So what is the joy choice? It's an important enough concept that I decided to title my book this. So I want to share with you what it is. And here's Pat's relaying it to you, and I'll read it to you. The joy choice equals the perfect imperfect option that lets us do something instead of nothing. It's really quite simple. Let's think about how the joy choice works, right? The blue square is something instead of nothing. And in this trajectory, in contrast to the red-filled trajectory of all or nothing thinking, in the joy choice trajectory, there's only momentum because something is better than nothing. And we pick that so we can keep it going. Let's remember that sustainable change is due to the consistent decisions we make right now and now and now. And this is how we can create it. So let me tell you some new things about the new story of behavior change. Number one, it assumes that we need to plan, but that our plans will go awry and that we need to learn how to flexibly improvise. When I first started talking about this in the springtime, I miscommunicated because people thought I was saying that people don't need plans, that it can just be flippy floppy all over the place. No, we need plans for anything that we care about trying to fit into our lives, especially consistently. However, we need to expect in the new story of behavior change that our plans are going to go awry, so we're prepared and ready to flexibly improvise. So let's go to the other quote, which of course, obviously is the high active group. If we have to spend time helping with the homework, the workout needs to go to the wayside for today, and so be it. You have to give and take. But there's concerns about this, and I understand why. This is where in a live audience, someone would interrupt me and say, but Michelle, isn't that actually going to cause bad habits? I mean, come on. It's got to go by the wayside for today. Really? That's going to cause a bad habit. Logical concern. But let me tell you a true story. So I was talking about this idea with a bunch of physicians. And when you're, teaching and training people new ways of doing things, you can see whether people are engaged and on target, like they're agreeing with you or they're upset with you. And in this specific instance, at this event, I could see a woman in the far back of the room. And she looked like she was so angry with me. And if any of you do public speaking, you know that it's very upsetting to see someone who you think is hating you in that moment and disagreeing with you. It's just disconcerting. And so it looked to me like she was going to just explode. And in just a couple minutes, she did. And she popped out of her chair. She put up her hand and then she pointed at me in a really accusing way and said, "How dare you, Michelle, suggest that it's okay for my patients to change around the exercise plan that I would give them? Their health is at stake. If they don't do what I've prescribed for them, their health is going to be at risk. A lot of them have chronic illnesses and they need to exercise in the ways that the research shows is best for them." Well, I was embarrassed. I was like freaked out. I didn't know what I was going to do. So I paused to try to gather my thoughts. And thankfully, a response came to me. And I smiled at her and I said, "How's that working for you?" And she sat right down. And of course it wasn't, because in an ideal world, patients and clients and we would be doing the gold standard amount and intensity and duration of exercise so we can get the optimal dose, or eating exactly as all of the nutrients that will help us create a healthy body. In an ideal world, we would all be doing that. But the problem is that when that is what most people aim for, when that is what we promote to our patients or clients, it sets a standard that most people can achieve. And of course, in that all or nothing scenario, people stop coming and they drop out and they feel like failures. And it's the stop and start trajectory. It's the start and stop trajectory that leads to nowhere. So that's the response to that concern. I'm going to propose to you that going off plan is actually adaptive and not a bad habit. And when I tell you this, I just was speaking at the Permanente group in California last week. And after this presentation, in the Q&A, someone further asked me, but Michelle, isn't this just going to give people permission to give excuses about why they're not going to do it? And the reason why we're so focused on this concern is because it's been embedded in the narrative, in the old story of behavior change. The alternative to what I'm proposing hasn't worked for over 4 decades. So no, I think if we teach people the new narrative, the new story of behavior change, which I'm in the process of doing right now with you, thank you for being on this journey with me. It isn't about bad habits. It's about learning to make more adaptive choices when we need to. And this isn't just a commonsensical idea. There's research to back it up. In fact, more and more research comes out. I want to tell you about 2 studies quickly. One study was a physical activity study. They followed people for 2 weeks, and they had people write down how much exercise they did. And then at the end of the study, they wanted to understand whether people who stuck to their planned exercise that was part of the study, how much exercise or physical activity they did compared to people who what they called substituted their activity. So if someone had planned to go to the gym at 5:30 like Pat, are the Pats who try to stick to the plan with all or nothing thinking going to do more physical activity over the 2 weeks? Or are the people who substitute out an activity, not go to the gym, but do something else, are they going to be doing more physical activity over the 2 weeks? And the research found, you won't be surprised because of where we are in the presentation, that it was the people who did activity substitution who did more physical activity. And in fact, statistically, activity substitution was responsible for that greater physical activity. That's one study. Another study was using a weight loss registry in Portugal. And they were interested, they followed people over a year who had maintained a certain amount of weight. And they wanted to understand if people who came to weekend eating more flexibly, called jargony, flexible restraint, or who tried to stick to the plan, what their weight loss trajectories were at the end of a year. And again, you're not going to be surprised, although it is counterintuitive, that the people who used flexible restraint and kind of modified their plans on the weekends had a more significant weight loss maintenance or better weight loss maintenance than the group that tried to stick to the plan. And here's why. The value of any choice is always going to depend on the context of all the other choices and needs in the moment. So Pat may have planned to go to the gym at 5:30 Monday, Tuesday, Wednesday, Thursday, Friday, but that carpool snafu and the need to pick up the kids and her inability to get to the gym at 5:30 changed the parameters of the value. So that's the new story of behavior change, is that we have to learn to navigate in the reality of our dynamic lives. So the new story of behavior change also designs solutions based on this reality, and it supports our brain's innate pivoting system. And if we were in a live audience, I would say to you, do you know what that system is? What's our brain's innate pivoting system? It's so awesome. It's our executive functions, which are our mental abilities that engage with novel situations. They help them problem solve. They help us problem solve, pivot, and manage long-term projects. And I'm sure many of you are very familiar with the literature and the thinking about executive functioning related to ADHD and other conditions that impact our ability to live our lives and manage the projects and people in our lives. But what you might not know is that there's a literature related to lifestyle change and executive functioning that I'm super excited about, and I was really excited to share in the book. And while we don't have time to go into all the 3 primary executive functions that I feature, I do want to talk about one of them, which is cognitive flexibility, or what I'm calling flexible thinking, because it is the underlying machinery for this. It lets us switch gears and make trade-offs. It helps us pivot, and it lets us navigate novel, unanticipated circumstances. And as you know already, what is the name, pop quiz, of the novel, unexpected circumstance in the new story of behavior change? It's the choice point.